talk about is the Dutch hormone test. I use this test a lot in clinical practice, and it's one of my favorite functional medicine tests for many reasons. It really is a great tool, and I think more women should be aware of it and utilize it. And so I want to go through it, talk about what it does, who is a good candidate for doing it, and then if you're interested in doing a Dutch test, giving you some options on next steps. So I've been doing functional medicine hormones now for about 20 years. And one of my favorite go-to tests has been the Dutch test, which is a dried urine comprehensive hormone test. What we're looking at here is we're actually getting a full panel of all your different hormone pathways. And by being able to look at these pathways, we can then not only see what your levels are, like what your levels of progesterone and estrogen and testosterone and DHEA are, but we can also look at all the pathways that these hormones break down. So if you're not breaking down testosterone correctly, or if you're too toxic so the estrogen isn't getting through the pathway, or you're not producing the right progesterone because there's an adrenal stress response, we see all of that with the Dutch test. And so it's very comprehensive, full picture, and then we can really go and improve what are the concerns for you specifically. So it's really just ideal for individual comprehensive treatment. The other great thing is that it really is a great test for women over all age ranges. So if you're a young woman, let's say you're 18, 19, your cycles just haven't gotten right, and you want some answers and don't want to just go on birth control, you want to know what are your hormones trying to tell you. Dutch test is fantastic. It's going to give us the insight into what's going on with your hormones so that we can also empower you to be able to help control and manage your hormones throughout your life. And so that's one of the things that I just absolutely love about it. If you're a woman that's suffering from things like PCOS, polycystic ovary syndrome, if you're suffering from PMS, PMDD, fertility, it's a great test for anyone who wants to get pregnant and is looking to find reasons or just things that might make it a little bit harder to get pregnant. It's also great for women coming off birth control who can't regulate their cycles or having problems with fertility after coming off birth control, because we can see where all these levels are and what we have to do to balance things out. The other thing that I really like about this test is that it's a great way to get a true marker of what's going on for a menopausal or perimenopausal woman. So looking at different options that are out there for this age range, that you really want to make sure that you're doing the right thing. And so many times hormone management in perimenopause and menopause is a one size fits all. And we actually see this throughout all hormones, but especially in menopause and perimenopause. If any treatment at all, it usually is a one size fits all. This isn't what we want. We want to know what our bodies are trying to tell us. We want to know what our hormones are doing specifically, and then we want to treat individually and comprehensively. And that's what the Dutch lets us do, and that's why I absolutely love the Dutch test. Now, we do have some options if you're interested in doing a Dutch test. You have to run it through a provider. And so if you are looking just to run it, we have, I think, the lowest cost out there for individuals that would like to run it. So if you just want to run it and then it'll get sent to you, you will see that that is an option when you click the link. Or if you want to go a step further and really be able to not only run it, but after you do run it, what do you do with that information? And sometimes, looking it up on blogs or trying to figure it out yourself can be very daunting. So I'm also offering for a limited time, and it's really first come, first serve, because after so many, I have to say no just because of the time constraint of it. But I'm also offering that you can get a Dutch test and then also do a reading. We will call you and schedule a time once the Dutch test comes in for me to call you over the phone or do telemedicine and be able to give you the information of what this all means. You'll see those two options, and it's a great option, either one. So I think, whether or not you want to even just start with the Dutch test, see what it says and go from there, or if you would like to just sign up right away for a discounted price to do a Dutch test and an analysis, please do so. I'm so passionate about helping to balance hormones, and the Dutch test is the way to go. And also, if you guys have any questions, reach out. You can always find us at info@oneagorahealth.com, or just find us at oneagorahealth.com, and you can always leave questions and comments there. Thanks, guys.